Hello and welcome to our YouTube channel. Today we have soon to be Dr. Vivek Podder. He is joining us from Dhaka, Bangladesh. This is our first time interviewing somebody from Bangladesh at this point. The reason we are talking to soon to be Dr. Podar is that he has published quite a bit during his medical school. Vivek is one of the aspirants for USMLEs, but he has achieved quite a lot. So, without giving further away, I would like to welcome Vivek to our channel in today's interview. Welcome, Vivek.
Yeah, thank you, Dr. Rahul.
I would like you to introduce yourself to our viewers. Tell us about you, where you are from, and where you in the journey so far in medical training.
Yeah, hello everyone. This is Vivek Podder, and I'm currently in the final year medical student, and I just finished my final professional exam, and I will be graduating soon. So currently I am in Dhaka, Bangladesh. So I am preparing for my USMLE step one.
Fantastic, Vivek. Thank you so much. So tell us about your journey of clinical research, actually, which is quite becoming quite famous on social media, LinkedIn and Twitter, and so on and so forth. So tell us, how did you start in this journey during your medical school? What was your inspiration, and how you come about of doing clinical research?
Yeah, thank you for the question. This is a very important and timely question that every USMLE aspirant and every medical student try to find the answer of. So when I started preparing for USMLE, I knew that US research is a very important part of the residency application. So since from that point of time, I was trying to understand how can I get involved in the research. So I was trying to look for opportunities around the world, and I was trying to approach different professors. So how can I start my research? So I got to hear about a BMJ elective program, which is a program from British Medical Journal. So this is conducted by one of the editor of BMJ case reports, and his name is Professor Rakesh Vishwas. So I approached him and told him about my situation. Then he accepted my request and invited me to join the program in India. So I went there, and I stayed there for 2 to 3 months. So it was basically a clinical and research blended learning program. So I used to stay there and see patients, and he was telling me about the clinical thing and also the research thing. He was saying that how when you are starting your research, you should focus on your patient. So when I was interacting with the patient, I was trying to understand that how these patients can be reported or published. He was saying that I can start my journey as a case from a case report. We as a medical student have a time constraint. We don't have enough time to publish, and at the same time we need to publish. So basically, when you are starting with the research, the very important thing is you need to understand the purpose of doing research. So when you understand the purpose of research, that is the moment you can dedicate more time to it. Unless you understand the vision and the purpose of doing something, you cannot focus or give you dedicated time for that. So I was trying to understand, because doing research is a very noble thing. A medical student, any medical doctor can contribute to science. So I started doing research, case reports, and that time I was not able to do and how to write a case report. So he guided me through the process. So what I'm telling, it is very important to have a good mentor in the process, because when you have a very good mentor, you can actually, even with a lack of knowledge or lack of skill, you can be a skilled person, you can be a knowledgeable person. So the Professor Rakesh Vishwas, he guided me through the process of writing case reports. So after starting it and publishing my first case report, I got boosted. I thought that yes, I can publish more case. I can publish more case reports and publish it in more journals. So I went to CMC Vellore, which is located in Vellore, India, and it is a very premier institute in India, which has training facilities for medical students around the world. So I went there, and I was very fascinated that the medical students there and the faculties are doing a lot of research and presenting their findings. So I wa- so I and that time I was very sensitized to do more research. So I communicated with them and shared my passion that yes, how can I do my research? How can I start it? I mean, as I publish case reports, there are a lot of studies going on, and how can I get involved there? So they told me, one of the faculty there was telling me that when he was a medical student, he published 25 research papers at that time. Even though the number is not important, but it is the important message out of it is, as a medical student, it is possible to publish, and it is really possible. It is doable, even with our hectic schedule. So we need to understand that publishing a case report and doing research is possible. So it is very important to have a mentor who is also who is uh, 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 who is actually guiding you, and who is also mentoring you, and giving you the motivation to do. So when I was there, even though I could not publish anything from CMC fellow, but the learning points that I achieved from there, that it is doable, was a pathway for me to proceed. And from that point of time, I was giving more time to research. And as I give more time to research, I got more mentors. Because when you're working for something so passionately, then the other people which find more impacts in you will guide you. Because people
Absolutely.
see impacts. When people see that you can make impacts, and you are working so hard, so
Yeah.
they will take you in. So wherever you are, yeah.
Absolutely. I think what I'm gathering from you so far is that you have to have a passion to do research. A good mentoring can get you far, as well as, and then you have to think that it can benefit the patients and then whole medical community in that regard. So follow-up question for you, Vivek, is that during a medical school, how did you find time to do these rotations, or how supportive your medical school program was, that you were allowed to go and do some of these things? What these, you did the optional time, or you took it during your summer vacation time? How did you find time to do these rotations?
Yeah, actually, I have a different story to tell here, because in Bangladesh and overall in Indian subcontinent, it is very difficult to get a managed time out of our medical curriculum, because it is very hectic, and there are no dedicated time for research. So no vacations, no mandatory programs that students should participate in the research. So what happened? A brief story I would tell about myself, that even though I was doing my medical school, but it has got a bit prolonged, because I had an open heart surgery during my medical training. So because of that, I used to travel to India a lot of times, and it was an unexpected educational gap which actually I had to take. But while I was taking it, even though during my operation, open heart surgery, and around the time, I was moving around for attending conferences, and meeting the different kind of people, and listening to the sufferings of the patients. So I was trying to understand that why a particular patient is exist, and how a medical student, even though I am out of my education, I am in an educational gap. So I need to make enough time for it. I should not go all this thing into vain. So I started so what happens is, during that time I was trying to join these programs, but I was actually approaching different mentors. So even so in future, even when I'm applying for USMLE, it doesn't affect my application. And also, even though it is a prolonging, it doesn't sound like I am not doing anything during that time. So
Absolutely.
that's how I manage time to publish, manage to time some optional time for all these things. But I think it is still a problem in because everyone doesn't have a similar situation. So even during their medical training, they cannot get enough time. So I advise, so I will suggest that even during our medical training, we can have enough, we can make out time. As I have told earlier, that you have to build a purpose to your action. So if you do that, you can find an optional time.
Optional
It is
time.
not a very difficult thing,
Yeah.
but that's how I got to manage the optional time
Well, kudos to
in my
you
medical.
that during your adversity and you turned that in an opportunity. Not very many people can do it. So very well done, and I'm glad that you are doing okay. Tell us about like what you have published so far, in terms of variety or numbers. So far, what has been your clinical research publication or output?
Yeah, basically, my publications has comprised of two things. One is research, and another thing is medical books. So I haven't told about my medical book writing thing. So I have worked doing the first aid for the USML step one, and I'm working for the third their I'm working for them for 3 consecutive years. I've also worked in there some of the other medical education projects, because apart from doing research, I have a passion for medical education. Because as a medical student, I have suffered that medical students are struggling with the learning strategies of medical in the medical education, which is pretty much more or less in everywhere, which is more prevalent in our part of the world. So I was thinking that if I'm able to contribute, if I'm able to
That's okay. Go ahead.
if I can contribute something which can help the medical students, that will be a very beneficial for it. It is very rewarding actually. So I started my while I was doing research, I was also writing medical books and working with the and I was working for first aid for the USMLE.
Sure.
So during that time also, one of the medical education projects I worked with, basically my research papers comprised of medical books, book chapters, commentaries, correspondence, then research article, one clinical trial, and then some cross-sectional studies and case reports. These were the different kind of studies we have done until now. And
Fantastic. Very well done. So those who are in, so what advice you would like to give for those who are in your situation, who are in medical school, either second, third, or fourth year medical school, or who have done and then they're preparing for USMLE exams, or waiting to get into research? What advice you would give it to your fellow medical students and USMLE aspirants?
yeah. So thank you for the question. This is a very interesting and important question. And because in current situation, research is a very important part of the application. So student, as I have already told, so if I told in bullet points, so a student should have the first of all, when someone is starting, they need to have a vision and purpose to starting research. And one of the purpose can be residency application, because in the residency application, one student the chances of getting matched is increased with increased number of publications or research publications or more research experience. So they should have a purpose, because once they establish the purpose, they can move forward with the process. So this is first thing. And the second thing which I will emphasize more is networking. Because we need to approach, because when it comes to networking, it becomes very difficult, because medical students feel that how can I network, I don't know anyone, whom should I contact? So I suggest that you can join there are many different kind of professional organizations which offer medical student membership, so they can easily join there. And there are so many mentor mentee directory. They can communicate with them in the email with their interest. And also there are some organizations like American College of Cardiology. They have some subgroups where they can share their interest, that I want to start my career, because there are so many students and so many mentors who know the pain of this, so they can guide them through the process. Another thing is, apart from starting research, they should participate in a different conferences, because currently due to pandemic situation, not many people can join it physically, but still one should join the conferences, because in conferences there will be many students who will be sharing their own research. Because my journey is my journey only. So if you can hear more journey, more experiences, you can know which one is fitting your thing.
Absolutely.
Because
So true. So
yeah,
true. So, having a passion and purpose for research, having a mentoring opportunity, and having a networking opportunity through conferences or your personal communication is going to be very, very important. Thank you so much for sharing your story and coming online on our channel today. We would like, if our viewers would like to connect with you, do you have any social media pages to tell us so they can connect and connect with you? Maybe LinkedIn, Twitter, or anywhere else? Please share with us.
yeah, students can connect with me in they can follow me in Twitter, which is at VPODDER, which is my Twitter handle. And people can also connect me in LinkedIn, which is my name is Vivek Podar, which is Vivek space Podder. And people can also connect me in email ID, which is drvivekpodder@gmail.com. So if anyone require any kind of help or any kind of favor or any support, I can always try to help, because I know it is very important that people they need information, because in current information informic, correct information is very important. So anyone can contact me.
Perfect. Thank you so much. We are so glad that you could join. Thank you for sharing your personal story as well as your journey for clinical research. And then we are so glad that our viewers got to meet you. And we hope to have you come back again on our channel to share your next achievements. We are very thankful for our viewers. Please do
Thank
like, subscribe, and this channel, and make sure let us know in comment section what you liked about this video and what other videos you want us to record. We'll be happy to respond back to you. Thank you so much.